Yesterday, we received our first positive COVID-19 test. The child presented at our Adele Hall Campus Emergency Department Sunday evening with cough and sore throat and a history of fever. After being fully assessed and found to have a minor illness, the child, who also had possible contact with the coronavirus, was swabbed and then sent home. We received confirmation yesterday morning that the child's swab was positive for COVID-19. We notified the family of the test results, and the family agreed to self-quarantine. We reported the case to the Kansas City, Missouri Health Department, who will notify the health department in the area where the patient lives. We spoke to the family this morning, who reported that the child continues to have mild symptoms and is recovering at home. At Children's Mercy, we always are prepared to handle any infectious disease, so this is not new to us. We followed our standard protocols, and we are confident that in evaluating this patient and any other child who presents to us, all the necessary precautions are taken to limit transmission of disease and infection. We have one of the best trained pediatric medical staffs in the country who have prepared their entire medical careers for moments like these.
We have tested 103 patients, and this is our first positive case. In the emergency department, we have actually changed the way we bring people in. And with coronavirus being in the area before it actually came to Kansas City, we implemented a system where we take our respiratory illness patients that are presenting with fever, cough, shortness of breath. We are placing them in a different waiting area. They are running through a different area of the emergency department from the patients that don't have those symptoms and may be coming in for something else in the emergency department. So we have separated them the best we can. In addition, we have rooms and supplies and adequate materials to help take care of those kids and keep those patients isolated in the areas, as well as their infections isolated in those areas. Patients that come in that have respiratory symptoms are being given a mask to put on when they come in to help decrease that spread in our emergency department as well.
We have the supplies that we need to take very safe and effective care of our patients. And we have adequate testing supplies as well. Most children appear to have mild symptoms compared to adults. We know this from data coming in from around the world. There are other countries that are weeks, and even other states that are weeks ahead of us. And we see that children are having mild fevers, coughs, sore throats, and things like that. Those children need to be kept at home. If they do not need to see a medical provider for their symptoms, they should just be kept at home, and you should practice social distancing as best you can. If a child does need to come in and be seen by a medical provider, then we encourage families to call their primary care physician before doing so. So the director of the World Health Organization actually came out with a statement about that today that recommended staying away from ibuprofen, so things like Motrin and Advil, but to favor Tylenol for a fever reducer currently. This child continues to have mild symptoms that are being treated with fever reducers and plenty of fluids at home. We expect the child to make a full recovery.
At this time, if a child has fever, cough, runny nose, if they have those symptoms, they could have any virus that's out there right now. As long as those are mild, if they don't have contact with a positive coronavirus patient or they have not traveled to a high-risk area, then we are not testing those patients. Those patients are instructed to stay home and to decrease contact with other people in the community. There is no treatment for coronavirus right now that will make it go away, and that's very similar to other viruses. So in the pediatric population, if there's not contact and there's just fever, cough, runny nose, we recommend staying home and stay away from other people.